Yeah, good morning. It's such a pleasure to talk about CASPAR. So CASPAR is a randomized placebo-controlled Phase III study that's sponsored by the Alliance and the NCI. So it's a cooperative group study, open in the US, and we're looking at the value of adding Rucaparib, which is a PARP inhibitor, to enzalutamide, which is an AR antagonist, as the audience recognizes. This builds on, about 4 years ago, Professor Clark presented data on Abi and olaparib in a randomized Phase II study, and that was the inspiration for us, because we'd been tracking the progress of this biology of inducing synthetic lethality in cancer cells by combining androgen deprivation and PARP inhibition. So when we saw that data come out, we moved and designed this study. Now the nice thing about CASPAR is it captures all of the changes that have been happening upstream before patients get to metastatic castration-resistant disease. So we have a pretty liberal entry criteria. We have allowances built in for docetaxel use in castration-sensitive disease, allowances for abiraterone, which is the most commonly used dual therapy agent in CSPC, and for any other novel antiandrogen agent in castration-sensitive or non-metastatic castration-resistant disease. So there's that part, and then the other thing that is very important about CASPAR is from the very beginning, our co-primary endpoint is overall survival. So we have radiographic progression-free survival and overall survival both built in as primary endpoints. And I think that's going to help answer some of the questions that were generated by the PROPEL data and the magnitude data, and somewhat dented their impact on our field, because we don't have the survival data yet, and then there is some question about whether it applies to everybody. So hopefully CASPAR answers those questions, is whether upfront combination works, makes people live longer.